Hey everyone, welcome back to Ask Amy. I have a question today from Liseanne who says, hi, just a short introduction before I ask the question. I'm a 34-year-old woman, 21 years bulimic and an alcoholic, although she's been sober for almost 2 years. She says, I came across your name and method yesterday and I'm so curious. I've tried everything for my eating disorder and it didn't work. But I really, really, really need to know what and how you think about alcohol addiction. She's seen some of the webinars, she says, about this work and is really interested in whether disease is a thing and my views on alcohol addiction. So she says, when it comes to overeating, you talk about how the brain works, and in the end, people have their freedom back and can eat normally. Okay, that makes sense, and I really believe you. But what about addiction? Do you see that as a real disease? Can alcoholics drink normally or socially? Just like with food, people can come to eat normally. She says, I'm definitely not looking for an excuse to start drinking again. Okay, sometimes it's hard when it comes to social events and stuff. And then she says in parentheses, and now you're probably thinking, well, let's look at that. I am, but we'll get to that in a minute. She says, but I always thought if I can eat normally, I can also drink normally. But society sees it differently. Once an alcoholic, always an alcoholic. They like labeling. Yes, they do. And maybe they're right. I just have doubts. What if I can train my brain with food to not overeat and purge, and also can do the same with drinking? Doesn't it work the same way? How do you see that? She says, I think you're the first person in my addiction life who can actually help me, and I really want to say thank you for your different approach and method. Awesome, Lisanne. So, okay, so there's a few things in this. Let me start here. I think what is biggest and most key and maybe most fundamental to this is seeing that what we think these things do for us, they don't actually do. Or even saying another way, what we're looking for when we overeat or drink or whatever, like what it feels like we're getting from that is something that we already are that. So our mind gives all the credit to the food or the alcohol, right? It starts to look like I need this food, like emotional eating works, it helps, drinking works, it helps, whatever it's working and helping, doesn't matter. It adds something. It looks like the food and the drink add something to our lives that we don't know how to find anywhere else. And that's what keeps them on the hook. That's what keeps them front and center, right? Where it looks like this is all about food and drink, even though we know it. I think everybody probably kind of knows it isn't. In some way it keeps them very much front and center, but that's because it looks like there's a feeling here. There's peace, there's relaxation, there's comfort, there's easier social situations, as you say, that food and alcohol help me with, and I need them to get those feelings, or at least I can get those feelings most easily through food and drink. That keeps us kind of in this bind where no one wants to not have relief. No one wants to not have peace of mind. No one wants to be uncomfortable in social situations or anywhere in life. And if it looks like there's this thing over here that's going to do the trick for you, it's going to be hard. And this is what sets us up to use willpower, because we still believe that food and drink, and again, you can put in anything you want here, cigarettes, drugs, gambling, technology, whatever it is, we believe on some level, even if we intellectually know better, we feel and we deeply believe on some level that that thing is helpful. It adds something to my life. It gives me something I don't know how to get otherwise. You kind of have no choice but to like, it sets up a conflict, a big conflict that we kind of need willpower to get out of, in a sense, like, yeah, this is an appealing thing, but I'm going to fight it. I'm not going to do it. I'm going to try to find my peace somewhere else. But it's not lasting. It's hard because you really believe you're missing out on something. So I think what's most key here, what's biggest to see, and what people come to see when they have deep, lasting freedom is these things don't give us anything we aren't. They don't give us anything that we need from them. That so basically what that means is we kind of, it's hard to describe in a short blurb, but it's like we come to see that experience is okay, all of it. Even the crappy experience, even discomfort doesn't have to feel like discomfort. We start to welcome all experience, what our mind calls good, bad, comfortable, uncomfortable, relief, urge, craving, all of it. We come to see this is all just energy. None of it is me. None of it means what my mind's telling me it means. It's all fluid and fleeting. And we come to just expand into all of this and get so much more comfortable with anything that arises. And when that is the case, it simply does not appeal to you to overeat or overdrink. It just doesn't make sense. Why would you? Why would we do that? Overeating or binge eating or emotional eating outside of satisfying hunger, with some minor exceptions. I know that eating has some pleasure for sure, but overeating when you're not hungry is not a pleasurable experience. Drinking, people would say, is not an innately pleasurable experience at all. And again, you can look back to your first drink to see how disgusting it tasted and to remember how weird it felt. Now we override that with our mind. Our mind says, oh, but now I love it and now it does this for me. Yeah, but you had to learn that. So it's not true. It says alcohol's not a pleasant thing. It's a poison. It's not an innately pleasant thing whatsoever. So as we start to remember that and see that, and our capacity to be in any experience expands, which is exactly what happens as we come to explore who we are and how experience works, that it is just this energy, then these things tend to fall by the wayside without willpower, not with willpower needed, just by insight, because it's like, well, I know who I am. I can feel peace without this. Why would I need to add that? So, Lisanne, so that's the big picture kind of answer. I do want to, your questions. What about addiction? Do you see it as a real disease? No, I don't see anything as a disease. Maybe COVID. I don't think that's a disease either. Like these are just words, right? I don't know no, I don't think addiction is a disease. You're right about people loving to label, like once an addict, always an addict. I don't believe that whatsoever at all. Not at all. Not in the least. So I don't believe in that disease model. I just don't, it's not even my belief. I don't see it in the people I work with, and from this understanding that there's a disease model such that as soon as someone takes one drink, they're diseased and it's all over with. That's not my experience at all. And I want you to be very curious, and just a neutral, curious way. I want you to be really curious about this desire, even to, or even just your curiosity about wanting to drink socially, and is that possible, and can I train myself to do it? And the reason I say that, Lisanne, is because when we're asking that question, most often it still looks like there's something in that for you. Like life is better with alcohol than it is without, or, again, it's kind of what you're asking. Like, if I could drink socially, that would be the best scenario, better than not drinking at all. And I'm not saying, I'm sure a lot of people feel that way, but I want you to just be curious about that. Why? Why is my life better with this substance in it than without? Especially as I can come to deeply feel at peace, not needing anything. It just doesn't really make sense. And as a former binge eater and bulimic, I can say the same in that regard. And I used to have this thought all the time, like, well, I don't want to cut out all my foods, and that felt like, oh no. And I even had moments of thinking like, maybe I can just binge occasionally. And what I see now, years and years out of that behavior, is like, there's no way. There's nothing in that for me. There's nothing that feels good about it, that looks attractive about it, not even a little bit. Now, eating some of the foods I used to binge on, sure, I can eat those occasionally, right? But But the eating when you're not hungry and the overeating for comfort and to numb and all of that, when you don't, when that substance, food in this case, or alcohol, doesn't look like it does anything for you, you just don't want to do it. So the fact that you're curious, and again, I don't even mean this about you, I don't know your deeper intention here, but for anyone, when we're like, why can't I just, train my brain to drink socially? Maybe you can, maybe you can't. It's a very, very slippery slope, at least. But even if you can, why? Why would you? What if you can come to see that this substance does nothing for you and just not have it? And again, I'm not telling you that's what you should do at all, but I want you to be curious about the thought process going on, because if you're asking that question, most likely it still looks like it has some appeal, like it does something for you. And again, in a short 10-minute video, there's only so much we can do about that, but I want you to keep exploring this understanding, because that's what starts to really open this up for people and see, wow, I need nothing. I might enjoy things here or there, but if it's a matter of just mere enjoyment and you have a history of addiction, you're just gonna pass. Like, why would I test it? Why would I go on that slippery slope? But that's gonna feel like willpower until and unless you deeply come to see that alcohol never did anything for you. It never gave you anything that you don't already have all the time. And that's what this bigger work kind of points you back to. So excellent questions. Thank you so much for sending them. I know we just kind of scratching the surface on this, but I'm excited that you're diving into all this, and I hope it's going well for you. I hope to see you in the Little School of Big Change in the fall. Thank you guys so much for listening. Thanks for sending your questions. Please send them to askamy@thelittleschoolofbigchange.com, questions about anything at all. And I will be here every Monday speaking to them. So thanks, everyone. Have a great week.